My name is Sophie Lowry, and I am the Implementation and Involvement Manager at the Health Innovation Network, which is an academic health science network based in South London. So I'm chairing today's event, and I'm also joined today by my co-chair, Natt. Natt, I don't know if you want to introduce yourself quickly.
I will do. Hello, everybody. My name is Natt. I am the Patient and Public Involvement and Engagement Lead at UCLPartners. So similarly to Sophie, we are an academic health science centre that sits across sort of north, central, northeast and London and mid and south Essex.
Thanks, Natt. And I'm also joined today by a number of other colleagues and some great panellists as well, who will kind of introduce themselves in time. So I'm going to have a sort of run through of what today's event's going to be. So I'm just going to give a brief overview of the topic and talk a little bit about why involving people and patients is important. Then we're going to have a panel discussion before an opportunity for sort of a Q&A. Just wanted to talk a little bit about what we mean by involvement initially. So there are varying types of involvement, and people use several different terms and they use them all interchangeably. So as a brief overview, through the kind of common terms they use, so there can be participation, which is where people can take part in the project. So this might be things around recruiting patients to collect feedback for a survey around a product or a service. We also have engagement, which is more around the kind of dissemination and sharing of knowledge and information. And then there's also kind of involvement itself, which is generally where people are more actively involved in work. So that could be through lived experience partners or co-design or co-production and various other kind of methods. So sometimes these different types of involvement are shown in a kind of scale. Sometimes you see it as a ladder format as well. And so this is kind of showing how you can move from sort of more passive involvement around things being done to actually through to a partnership arrangement. And actually, that's what we're kind of focusing on during today, is the sort of right end of the scale around partnership with people. So Kheiron, who's one of our panelists today, actually showed me this slide, so I give her credit for this. But I think this image really sums up involvement very well. So often when people hear about involving patients, they think that it makes things harder. And so looking at this image, they think that people or patients are the rocks in the basket, weighing them down and holding them back. But actually, people are the wheels. So with patients, I strongly believe that patients can actually help ease that journey, and that allows you to sort of progress further and develop further. So very, very briefly, why should you involve people and how can they help you actually progress further with your innovation? So by involving people, you get to know what the problems are. And actually finding out these problems and getting feedback from people around existing issues is really powerful when you're creating a case for change for a new innovation. And then through learning the problems and the inequalities and the inefficiencies, you actually get to know what people's needs are. And then you can target those and respond to those needs by co-developing and designing new innovations which address those needs. Together, you can then test and evaluate the innovation itself. Before moving on to more implementation, because actually a majority of implementation failures are as a result of not adapting any sort of evidence-based care or innovations to a sort of local context. And actually for involving people, it can really help you to understand the local context and needs, and make sure that you adapt innovations so they can be successfully implemented and spread and adopted. Also, other reasons for involving people are because there are actually sort of guiding principles for research and commissioning in the UK, which need to be followed when conducting research or commissioning a new service. And how can people contribute? So there's many different ways, and just touching on a few here, and I'm sure we're going to hear lots more during the panel discussion as well. But as a bit of a starter for 10, people can share their experiences. They can act as a source of expert knowledge, and they can also help you to identify priorities and change focus for various quality improvement. Additionally, they can help you with developing potential solutions through bringing innovative ideas and solutions as part of any co-design work. They can also help you to advise on any barriers and facilitators to implementation specifically. And finally, they can actually help with designing evaluations and helping to implement solutions through ongoing engagement. Great. And I'm just going to finish with this slide here, which I think really nicely sums up why involvement is important. Yeah, just a nice image. Great. So after that, as I say, whistle stop tour, we're going to move on to our panel discussion now, which is why everybody's here, and should be really insightful. I'm personally really looking forward to this. So I'd just like to introduce our panelists. We have Erin, Scott, and Kheiron here today. Erin, would you want to introduce yourself briefly?
So I'm Erin Barton. I am an external advisor and chair of the Patient and Public Involvement Advisory Board at a company called Kheiron Medical Technologies, and we're using AI to detect breast cancer in the breast screening programme. Previously, background is sort of NHS and working for cancer charities, so been involved with patient involvement for quite a while.
Thanks, Erin. Kheiron?
Hi there, I'm Kheiron Dale. I'm a programme director at the Health Innovation Network, so working with Sophie on a day-to-day level. I've recently been appointed as a trustee of the Point of Care Foundation, who are real champions of patient experience and patient involvement. And I've been working in involving patients in improvement and innovation for a longer time than I could bear to mention, really.
Thanks, Kheiron. And Scott, could you introduce yourself briefly?
Yeah, good afternoon, everyone. So I'm Scott. I am somebody who originally trained as a physiotherapist, but not long after training, I suffered a major stroke and lost my vision as a result of the stroke. So I have quite a few physical impairments, but also the sight loss as well. So I'm somebody that's quite significantly affected by digital health. So yeah, really looking forward to the discussion today.
Thanks, Scott. Great. Well, get on with the discussion. So first, I wanted to ask Erin's questions. So Erin, could you tell us a bit about why you, as a company, decided to do patient involvement?
Yeah, sure. So patient involvement is something that we've always had to do in lots of ways, and sort of some elements of patient involvement. So normally it would be sort of a section in a grant application or something that was necessary for ethical approval of some research that we're planning. But I think Kheiron as a company, even before I was hired to sort of lead on PPI, they've always been fantastic at appreciating that sort of investing money and time and energy into it is sort of the right thing to do, both for patients and the public and for the business. So an example of us sort of doing it for patients' benefit is one of our campaigns that we ran. So 31 Wishes it was called, and it was for Breast Cancer Awareness Month. And we just decided to showcase the stories of 31 individuals who'd been affected by breast cancer. They were patients, family members, some of them were doctors, husbands, kids, and they were all able to tell their stories in their own words with absolutely no guidance or restrictions from us, apart from the fact that they weren't allowed to sort of mention Kheiron and what Kheiron does. And they ended with their wish for the sort of future of cancer, its detection and treatment. And it was primarily a sort of awareness raising campaign, but it also helped establish us as a company that actually cared about our mission and not just promoting our products. So I think in terms of gaining trust, I think that was a really helpful thing for us to do. And then for the company's benefit, I mean, where do I start? We've used PPI to support particular consent model for our research projects. We were able to include it in our pitch decks for potential investors, and when engaging with new hospitals. We're able to showcase our PPI work at conferences. So the sort of benefits to the business, I think, are endless. And if you're sort of struggling to I suppose, get buy-in from colleagues or the executive team for actually sort of funding and committing time to doing this. I think if you just listed out all the ways in which involving patients could benefit your company, I think you'd be able to win them over. For us, it was difficult to know where to start. So what we decided to do was start with one particular project and use that as the blueprint for how we sort of deliver patient involvement and engagement as a company. So we won one of the AI in Health and Care Awards, one of the NHS grants, and we decided to use that particular project as a really good sort of test of how do we actually involve patients from start to finish in something like this. So yeah.
Thanks. And you've touched on some of this already, but could you tell us a little bit more about your experience then undertaking patient involvement as a digital health company and the work that you've actually done?
Yeah, so I'll pull out a couple of things that I think are interesting. So firstly, what we did was we made sure that we embedded patient involvement in our governance structure for the AI in Health and Care Awards. So lots of boards, some of them are clinical, some of them sort of the day-to-day running, some of them are finance. But one of those is our Patient and Public Involvement Advisory Board, and they feed directly into our executive teams. That means that we've got sort of direct route for patients to have an impact on what we're doing. We decided it would be made of sort of 5 to 7 members, and we started off with just sort of 3 founding members that were very supportive of what we were doing, and went to them and asked them, how do we run this? So they had input into the terms of reference. At our first meeting, they told us how we should go about recruiting the other members. So we only had a few spots, and you know, who should those people be? People that have had cancer, people that haven't. What backgrounds do we need? Do we need more diversity in a particular area? So they were able to help with that, and be our supporters and work with us very closely on the project. And the second thing that we've done is create a plan with involving patients and the public from the beginning. So we decided to co-produce a PPI strategy with help from the Co-Production Collective, who work at UCL. They were able to help us plan and facilitate those sessions just to make sure that we were sort of living and breathing the values of co-production, and that we were working in equal partnership. So it actually allowed me to be an equal member of those discussions rather than sort of leading or steering them from my perspective about what I think we should be doing with our time and money. So they've been really helpful. We've had 3 sessions so far, and we've jointly come up with a vision, and we've come up with a mission statement, so the things that we need to be doing to get there. And we're currently in the process of just prioritizing sort of actions, outputs, activities that we want to do over the next 18 months that we think are going to help propel us towards that vision. So really, really beneficial, and happy to share that work once it's published with everybody.
Thanks, Erin. Yeah, I think everyone would be really interested to see that, myself included. We've just gone through a process at the Health Innovation Network of developing an involvement strategy for ourselves, and it's I know Natt has also just done this for her organisation, so it's a hot topic at the moment.
Yeah.
But yeah, sorry, going back to asking questions. So could you then tell us a bit about some of the challenges you face as well? You've mentioned some of the benefits. But,
yeah, definitely. So you actually set me up really nicely to talk about some of the things that I thought about that were challenges. So the first one I thought about was sort of changing people's perception away from traditional patient public involvement. So I found that at conferences, when I explain what I do and that this is sort of my entire role, people have said things like, you know, what is that? What does that mean? And they work in a company that I think should be involving patients and the public in whatever they're doing. And when I've asked the question back, you know, how have you involved patients? They normally, it's sort of down the left-hand side of that scale that you showed, they sort of say, oh, we put a poster up about what we were doing. And it's more about informing people rather than involving them from the beginning. So I do think there's still a long way to go with looking at sort of wider patient involvement and the benefits of it. And probably the best way of doing that, I think, is to just have really close involvement, for example, from a board, or have a few people that you work with very closely, so that you're always thinking about how they could input into what you're doing. And that is also true of my colleagues. So something that happened when I first started was that I went round to all of the teams and sort of said, how can I help? And the answer, that was sort of the response that I got was, well, how can you help? I'm not really sure what's on offer here. And so I had to do a little bit of explaining what my job was and how I might be able to benefit their different teams. So, you know, anything that you think could benefit from a patient voice being brought in, anything that you think needs to be looked over, anything where you want patient input essentially, and that could be any of their work really. And so I had to do a little bit of work to sort of raise my profile within the organisation, I suppose, share what I was doing at all staff meetings, make sure that we were including patient involvement in staff inductions, make sure that I was sort of offering training. So Co-Production Collective came and did a really great session on what is co-production and how might you use it and what are the benefits. So trying to sort of make it an organisation-wide responsibility was one of the first things that I did, and that's really helped. And I've had so many more requests now, people coming to me saying, Erin, this is what I need. Can you ask the board? Can you get the board to look over this? Can you get their input? So it's definitely worked. Repeating the offer, how can patient involvement improve your work? Come to me with questions. The third thing I thought about was gaining people's trust. So I said my background was in the NHS and breast cancer charities. So always had patients at my disposal or people at my disposal that were happy to input into projects. And so I had to do a little bit of sort of seeking out people that were supportive of what we're doing, and people that might be more suspicious about what we're doing as well. And I just found it was much harder sending people an email saying, can you help with my project? I think people saw that we were a commercial company trying to make money at the end of the day, and we didn't have an NHS logo to support us, or a well-known charity logo. And so that part was a lot harder. And the way that I sort of approached it, I suppose, was by not including too much information in my emails, just sort of making it seem like a really genuine offer for them to input into something, being quite clear about what I would offer them in return. So whether that's sort of vouchers or any sort of other way of supporting them to participate. And then talking to them face to face about it, because I think things like this always come across better when you're on a call or on a video call saying, you know, I actually genuinely do want to hear what you think, and there's nothing funny about this apart from you just giving me your opinion and us rewarding you for your time. So that was one of the challenges. And I think just keep going with it. I think one person sometimes opens the door to a whole community. So once you've got somebody on board that is supportive of what you're doing, they can then reach out to those communities and say, you know, this isn't funny, get involved. They are being genuine and they just want to hear your thoughts. And something that I thought would be a challenge but hasn't been is talking to people about the technology. I think in our heads we thought this was going to be a much bigger challenge than it was, but essentially people aren't stupid and they can understand enough about our technology, which is AI, to know what we're trying to do. And with the rest of it, with sort of helping us to explain our product and our project to wider patients and public that aren't as closely involved. They've just been instrumental in helping us find the right language and the right ways to communicate. So I think something we thought would be a challenge there necessarily isn't, and you can use patient involvement to help you with that. So yeah.
Fantastic, thanks, Erin. It's really insightful. Now I'm going to move on to Scott actually to ask about things from the other side, I guess. So Scott, could you just tell us about your experiences of using digital tools?
Yeah, so as somebody that is blind, I am somebody that has faced considerable digital exclusion, but also for me, digital tools open the world to digital inclusion as well. So if tools are digital, then it means that I can participate in things way more than I ever could. So actually, like today is the best day in history for me to be blind. So when it comes to healthcare, you know, the more things that I can access digitally mean that I don't have to get people to assist me with things. So, you know, as a really crude example, I'm constantly being sent letters about appointments or clinic letters in paper format, and I have to get my wife or someone close to me to read those letters for me. If I can have those sent to me digitally, then that gives me autonomy over my care and autonomy over my treatment. So, you know, that gives me, if those are sent to me in paper format, that means I'm being digitally excluded. If they're being sent to me electronically, then I'm being digitally included. So, you know, for me, it is as simple as that. But, you know, we can really push the boundaries on how we are really thinking about including people. And it isn't just around, you know, sight loss. There are many other areas of the population where people are looking, are looking for their help, you know, their healthcare to be accessed digitally. You know, so many people access different aspects of their life digitally. You know, we think about online banking, food ordering, things like that. And they're sitting there thinking, you know, why can't I access these things related to my healthcare in this same way? But it is also really important to point out that just because so many people want to access these things related to the healthcare digitally, not everyone wants to access these things digitally. So it is really important that we have a hybrid approach to this. So it's not digital by default, it is digital by choice. And I think that is a really important distinction that we need to make with everything, is that that we really look at everything that we are doing around digital healthcare and make sure that we are including as many people as we possibly can. But that also goes for people that are working in the healthcare system as well. So I have previously worked in healthcare teams, and there was a huge frustration for people working in the healthcare system as well. They want things to go more digital, and the systems aren't necessarily thought out. So going back to my digital letter example, people want to send out digital letters, but the systems aren't there, aren't designed in a way that link up to, say, the patient database system isn't linked up to the team mailbox system to be able to send out emails about patient letters. That's a really crude, simple example, but if you're an administrator working in an NHS team, that is a massive headache for you. So again, thinking about people that are designing digital healthcare systems, we really need to get people that are potentially using these systems, both patients and people, again, on the front line, in the process designing the systems, because it's much easier to design accessibility at the point of conception rather than trying to retrofit accessibility. And I don't just mean accessibility from the point of view of somebody that is blind, but I mean accessibility for any end user.
Thanks, Scott. No, it's really important, and yeah, definitely thinking about the value that people can add during the design process is really important. So thinking about your kind of experience of involvement, could you just tell us a bit about, I guess, things that maybe haven't gone so well, and how your experience of involvement could be made better?
I think really where it hasn't gone well is where actually things have. It kind of comes back to my last point, actually, where involvement hasn't been considered from the outset. So to give you an example, actually, and I'm not going to give a healthcare example here. So I have been doing some work with an organization called Basecamp, which some of you might have heard of. They design project management tools. And I've been doing some work with them for some time on how they can make their product more accessible. And they have really tried to make their product more accessible, but they're trying to base their accessibility on an old code base. So they're trying to retrofit accessibility, basically, and that is really hard for their design team and their coding team to try and retrofit accessibility. Whereas they have another product called Hey, which is an email application, which they have designed from scratch, and they have really thought about accessibility with that product, and they have involved people with with different accessibility needs from the ground up, and it has been much easier to make that product more accessible, which is, has really highlighted the point that actually designing products with accessibility in mind or usability in mind, and the different people that are going to be using those products from the outset is much easier than trying to retrofit those kinds of things. So for me, that is a really big reflection on how actually involving people from the earliest point is much more effective and much easier for any organization. It's actually much cheaper as well, because trying to bring in people and trying to retrofit, whether it's accessibility or usability, is actually a big cost in terms of, people hours and bringing in people and having to refactor loads of things as well. So yeah, those are kind of my reflections really on that.
Really insightful. Thank you, Scott, for sharing this with us. I'm going to move on now to our final panelist, Kheiron. And so, Kheiron, I think somebody just asked this question in the chat, actually.
Yep.
But
Just
so this is ideal. I was going to ask you if you could tell us about some of the ways that companies and innovators can actually recruit people and bring them in to get them involved.
Yeah, thanks so much. And I'm really honoured to be following Scott. I hope that just people hearing directly from Scott and his personal experience, that's the clearest way in which any of us can demonstrate the importance of involvement, because I can tell from the chat that people are already gaining insights from the things that you have described, Scott. And that's the point. That's the point of involvement. That's why people wish to be involved in things, and that's why it's really important that we do put the effort in to involve people with lived experience, with insight about access issues, and who can really contribute to helping us develop better innovations, essentially. So I wanted, with the question that came up in the chat, which is how do I find, I think it was the right person, the right patients. This reminds me of a conference I went to over 10 years ago, which was a health conference, which was about patient involvement in health services, where a very wise woman said, stop looking for the perfect patient, stop looking for the perfect person to help you, because that's an excuse to not get people to help you. So put effort into finding people. Think about what is the tool you're trying to develop, or what is the innovation that you are trying to do. Who are the people who you want to use it, and what? So do think about the demographics. Do think about the accessibility side of things and the type of people that you want to use your product, and who are the normal. If we're talking about health things, so in most health conditions there are usually certain demographics of people that are likely to get that condition. So do seek out people who match that, and then do think about diversity. So classically, I have to confess, when I first started doing involvement in cancer services, I did tend to invite white middle-class women to get involved, and we absolutely know that it's so important to get a diverse range of people, because those are the people that need to use the tools that we're working on. So think actively about that, and I'd say particularly think about people's reading levels. Make sure that you are accessing people who perhaps had a lower level of education, because so much of our innovations are dependent on people's understanding. So ensuring that you've got that range, because most of the people that I work with in healthcare have an education level that is much higher than average. So that's that's really important. And I think the other thing is around digital access. I think it's quite an interesting topic when you're talking about digital innovation. Some people will be of the school of, well, we're doing digital innovation, so we don't need to think about digital access. That's for someone else to think about. But if you're thinking about the population that you want to impact on, and what are the digital restrictions for people, and some of those might be financial, and some of those might be access to gadgets, but a lot of it is to do with how usable is the tool that you are then developing. I mean, the number of digital tools that we have in the NHS for doing bureaucratic things that are not user friendly is astounding, really. So this is really all about having people help you to make something more usable, so that will lead to more people using it, which will lead to greater success. It's an obvious win. But where do you start, and how do you find the people, and how do you go about that? I think there are a number of different mechanisms, both if you're part of, if you've got associations with clinical teams who have direct access to patients, who have patient clients, then it's possible to invite people through those routes. I thought it was really interesting, Erin talking about sort of having legitimacy. So it might be that you need some sort of means of demonstrating to members of the public who you are, how you're legitimate, how you're funded, sort of be really transparent about what you're trying to do, why you're asking people for input, and what you're going to do with that input. So there are two sort of concepts within which actually I learned through research ethics, which are about consent. So if anybody is helping you with anything, make sure that you've got that they are definitely signing up to agreeing to do whatever it is you want them to do. And then confidentiality. So if you are accessing any information about a person, that you are utterly by the book about what you do with that information and are totally transparent. And when you're inviting people to participate, at any point they can say, I no longer want to be a part of this for whatever reason, and there's no problem with that at all. And when we were discussing this beforehand, Erin has pointed out that academic health science networks, who are here to liaise between digital companies and the system, can also sometimes be really helpful in terms of helping you navigate that space between people that you're wanting to involve and the company themselves. And I'd also really suggest going via organisations that represent patient groups or patient interests, either specifically for the condition or the innovation that you are trying to bring about. And there's also wider ones as well. So what were the other things I was going to say? Did you have any other questions for me, Sophie? Or was it kind of...
No, that was just it. I think lots of tips there, Kheiron. Is there anything else you want to say burning before move you on?
There definitely was. Just reviewing my notes from what people were saying beforehand. I think that in terms of representation and ensuring that you've got people who really do represent the demographics and the groups and the interest groups of the patients that you're interested in. And when I say patients, I do apologise, because that's my shorthand for people who happen to be in need of services. So do think about your language. In mental health, service users is the correct term. In maternity services, we don't talk about patients as much. So do think about the language that you're using. But another top tip from another really wise person was to make it a doddle, make it as straightforward as possible for people to participate and take that participation seriously. This is a really important contribution that people are making. So think about payments. are you in a position to pay people? What means do you have to reimburse people for their time and effort? And it might be, so Erin mentioned vouchers. There are also other means of sort of payment in kind. You might be able to help people to access things that are important to them, which could be speaking at conferences and contributing to things alongside you. So even if you're not in a financial position to actually pay people, you will owe them something if they're participating. So do take that really seriously and think about how you might make sure you're not exploiting people when you're involving them in your work. I'm going to stop there for now.
Yeah, we'll stop you there, or I'm sure you should go on for longer, but thank you, Kheiron. Before we kind of open the floor to everyone here, I just wondered if any of our panelists wanted to comment further on anything anybody else has said or add to that at all.
Okay. I was just going to say, don't let the representation part stop you from starting. So we started, the 3 people that we got involved in the board to begin with were all white middle class women. And that's just sometimes how it goes. But they were actually really good at helping us identify who else needed to be on the board. And then we then sat down and said, we've only got this many spots left, and who do those need to be taken up by? And we were just really deliberate about going out and finding people that would fit that bill. So whether that was their particular experience, their ethnicity, their background, their education level, so we could then go and seek out making it more diverse. But we just got started anyway, because otherwise it was going to, before we had the perfect board built, it would be another year, let's say, and we've just not done any patient involvement. So just get started, and you can always worry about being diverse and making everything sort of perfect later, I suppose.
Thanks, Erin. Yeah, that's really useful actually. Is the starting small. I think sometimes people get a bit daunted about the idea of doing a full co-design and co-production, and actually sometimes it's about just making those baby steps, and actually, you know, you can strive towards, you know, doing better involvement, but it's just, that's the hardest part is the first part, and yeah, it all kind of flows from there. Thank you. Scott or Kheiron, did you have anything to add?
Yeah, so really getting out amongst the communities, and this is a problem in healthcare in general, is expecting people to come to, say, hospital for involvement, or, you know, expecting people to come to us in healthcare to be involved, rather than as an organization going out into the communities to go to the community to involve with them. And that would be what I would really recommend. But also, for me personally, I don't have any problem with using the tools we have in tech to help us in engaging with the community. So, you know, whether that be kind of targeting tools or whatever it be, you know, I would rather use some of the tools that we have at our disposal for good, rather than shoving horrible ads that are getting me to buy more stuff. You know, actually, let's use some of these tools for good, in terms of getting people involved in things that people really want to be involved in. You know, for me personally, that would be, I would much rather, excuse me, I would much rather see those things being used for genuine good, rather than trying to shove ads in my face for, you know, for me getting me to buy more stuff.
Yeah, I think that's a really great point. I just wanted to come back on Erin's point, because there's some stuff in the chat that I think we have to be a little bit careful that we don't. I remember being quite personally challenged that if you think of diversity later, yes, you do need to, it's that whole, you need people to be getting going, but wherever possible, think about diversity right from the start, because it's much harder to invite someone else in later if you've got an established group and you've thought about it later. So let's also aim to be better at that. And another thing I wanted to pick up on when Scott was talking, because I know, Scott, you're absolutely right that we need to involve people right from the start, and people always say that, but start from now. If you haven't involved people from the start, start now, and you will then learn that you should have involved people earlier, but don't be put off that you haven't done it sooner, because people can contribute. And I really liked Sophie's slide about the fact that people can help you with the knowledge of the problem that you're working on. They can help you with the design of the thing that you are working on, but you might have got through both of those stages, but they can still help with how you're testing it. How is the thing that's a concept in your head or on paper, how is that really working in real life? And then also implementation, when you're getting to a stage of scale up and spread, it might have worked in a specific conditions, but when you're trying to take this to wider populations or different groups, people can still help, they can still contribute and really give you value at all of those different stages. So just please bear that in mind.
Thanks, Catherine, and thanks Erin and Scott as well. It's really useful. Loads of tips and loads of things for people to think about going forwards. But for now, I'm just going to hand over to Natt, who's going to kind of facilitate a bit of a Q&A session. I know we've got lots of questions in the chat.
Yeah, we do. Which is great. So I think one of the biggest questions that seems to be coming out is all around this sort of like finding people aspect. And Christopher asked right at the start, before anything kicked off really, one of the challenges that we have in digitalisation projects within the NHS transformation is ensuring that we get this representative cross-section of voices, particularly from those who are digitally excluded and also people that we kind of call seldom heard voices. How do you tackle this? Like practically, how have you done this? And that sort of seems to be a thread that lots of people have asked, like, how do you actually do that? So any thoughts from the panel would be great. Who wants to come in first? I'm sure you've got lots to talk about because you spoke about it with us.
I'm happy to add some thoughts. So one of the reasons people might be digitally excluded is, as Scott said, it might be sort of accessibility type stuff. Something that we did, but we didn't have to do because we're not an NHS or public body, is an equalities, health inequalities impact assessment. It's a bit of a stuffy document, but it's just the best way of listing out all of the sort of groups that you could miss, you know, and going back to what I said before about being intentional about things later, we got started, but absolutely had a list of things that we needed to be focusing on over the next year, groups that we needed to speak to, lots of helpful organisations to help with that. They were all really helpful, actually. I was shocked. They were more than willing to help advertise opportunities with their members. So people like Disability Rights UK, Friends, Family, Travellers, so you can speak to the travelling community, all sorts of groups that, you know, there's some really obvious ones, but there were also some in there that I thought, you know, in focusing on all of these other things, I could have easily forgotten that. So a really good checklist to go through and make sure that you're being, that you've not missed any particular groups when you're thinking about being inclusive. Secondly, just thinking about the ways that you're having meetings. I think everybody's so used to having meetings now virtually and on Zoom, and it's great to involve lots of people, but I definitely have people that have wanted to be involved in the strategy sessions, but it was a real hard toss-up between sort of getting their input, I suppose, and then having people that didn't want to travel to London and couldn't be involved unless it was virtual. So there were people that are included digitally and excluded digitally more so, and so finding different ways for people to have input. So if they couldn't come to those strategy sessions or sit on the board because the board meetings were likely to be virtual, we've tried to think of other ways that I can go and meet with people face to face or get their input in other ways. So trying to offer different ways to be involved rather than just one opportunity. I don't think there's anybody that I've spoken to that I've not said, I will stay in contact with you as long as you're happy to, and said to them, what are the ways that you are willing to be involved and how can I help facilitate that? So everybody that I've spoken to might not be suitable for our board for whatever reason, because we're now at the point where we're positively discriminating for certain things. I don't want to say to them, I don't want your input, and I don't want to turn them away and say, actually, because you're a white woman now, I can't speak to you because we've got enough of those. So all of those people I'm still in contact with, and I've tried to take down as much information as they're happy for me to about the sorts of things they'd like to be involved in and the ways in which I can help them be involved. So yeah, you can positively discriminate, but I suppose still stay in touch with people whose opinion matters and not say to them yours doesn't.
Amazing. Thank you very much for those reflections, Erin. Anybody else want to come in on that point?
Yeah, I just really want to emphasize that point around just because you're looking at a digital healthcare solution doesn't mean that your involvement has to be digitally based. So really look at how you're involving with people and those involvement methods really need to be in whatever method the person needs to have in order for them to be involved. So I'm working on leading on a project at the moment that's around people with neurological conditions in Southwest London, and we're really trying to look at we've got online meetings, we've got in-person aspects, we are sending out emails to people, we're sending out physical mail to people, and as a project team we're really collating all of that information to really pull together all of the information that we're getting from those different methods. And it's really great because we're getting such a diversity of thought come into that part, whereas if we just done everything online and over email, we would get really quite a one-sided approach to it all. So it really is meaning that we're getting quite a mixed mixed thought to everything that we're looking at.
Amazing, very important. Thank you for that, Scott. Kheiron, would you like to add anything?
Yeah, I thought it might be helpful to build on what is being said and talk about the fact that I think you need to really work hard at thinking about who is it that we want to contact, what kinds of people, what kind of insights do we want to gain, and then be quite creative about how you might go about identifying people, and that you're going to start probably by identifying individuals, and it's fine to have a bit of a chat with an individual person, see what that brings up and see where that might lead and who else that might lead you to thinking about involving with. You don't have to set up a formal group at all stages of involvement. That's not the only mechanism. Some of this can be exploratory conversations with people who are potential users of your innovation, but they don't necessarily have to be committed to many project meetings. They can kind of give you some of that insight. It's a relational activity. This isn't just well, it shouldn't be a transactional activity, and I think that's really important. Obviously you want to get things out of people in order to understand and to build your products and to implement them better, but this is relational activity. This is getting to know people, this is getting to know what's going on in their lives so that you can add that richness to the development. And there's also been some things in the chat about also being quite respectful and careful in some spaces if you are invited into those places, and not just barging in there because you've got your really important project, always being really respectful of what is going on in those spaces. And with that in mind, a place that is worth thinking about is libraries, because libraries are public spaces. Be careful about just approaching people in a library, but I do think they're a really interesting space where people who perhaps don't have as much digital access at home will be going to access the IT services. Make friends with your local librarian and ask them to introduce you to people who they know access the digital tools and skills in the library, because they can't do that sort of thing at home. And I think that would give you some really interesting views on digital exclusion and inclusion.
Amazing, thank you. And I think between all three of you there, you've given some awesome top tips. And so I'm hoping everybody on the call is now like, right, yeah, let's get out there and go and do some of this. So another question that came up that I think is quite interesting that probably maybe we want to explore a little bit is a question from Alex talking about that in tech innovation, the advice is to kind of ask users what their problems are and then quickly develop solutions. But in healthcare, there's this idea that actually it should be a much deeper level of involvement, including things like involving them in your recruitment, etc. So can anyone kind of give any comments or thoughts or reflections on how to navigate this tension that seems to crop up between, you know, health thinking and tech thinking, and like in the in-between zone of health tech innovation? Scott?
Yeah, so I'll go on that one actually. So and this kind of comes back to my experiences with Basecamp really, where they would have really benefited from bringing in people with lived experience with different disabilities or different impairments much earlier in the process, because actually they went ahead and designed their product, and then there are people that were trying to use their product and couldn't use it, and they then had to like retrofit the accessibility. So I think there's a real benefit to bringing people in much earlier in the process. And that's not to say that you can't have multiple streams of development, but I think you need to really look inclusively at the point of conception of design really. And so I'm more inclined to think along the NHS route. I think have I kind of grasped what the question was there, or was...
Yes, you definitely have. And I think it is very important to kind of, as you say, like think about in a slightly like what's your impact, what your outcome type way, rather than, you know, that quick and dirty.
Alex, feel free to unmute if I've not if there's any more to that question.
I also think there's a range though, and I think that probably dominant models in healthcare have been quite formal, quite well-established groups, and there's a real value in ongoing relationships and people understanding the impact that they've had over time. There's also been, unfortunately, an experience in a lot of healthcare where people have just been asked once or come along to a thing and never heard anything about it. And nobody wants that, and that's not good. But that doesn't mean that there couldn't be quite agile approaches to people, kind of like inviting people to participate in a thing and then they being free to leave, you being free to leave, but making it really clear from the start that that's what I'm inviting you to this thing. I will let you know what happens, but you're not signing up for a 5-year commitment. And there might be opportunities to get involved later as well. I think it's being very respectful. That's what's important. Being respectful of people's time, being respectful of what they can contribute, and being really professional actually about it, and taking the input that people can provide to you as experts from their own lived and learnt experience really seriously. But that doesn't necessarily mean that you have to only engage with them for a long-term thing. I hope that kind of makes sense.
I think so. I hope so. If it doesn't, Alex, put a comment in the chat. But I would say what you guys are reflecting there actually also goes back a little bit to that point that we were making around how to engage with people, is lots of different offers and lots of different approaches and opportunities. So it's not just kind of like one bit. There are lots of places that you could fit it in, and different styles and different approaches for different communities. So it will have different impacts on your work. So variety is the spice of life, apparently, is what we are getting at in this. I think we've only got 2 more minutes, so I think there's not really time for another question, but there's lots of questions in the chat. So what I might do is take these questions from the chat and see if the panel would happily contribute some thoughts after the session, and then we can send it around to everybody. Oh, panel panels are
Okay.
nodding. So we can then reflect on some of these questions and send them back, or put them in a blog, that because this is kind of like a
That
month of
also gives
programming.
us time to find answers to some of them more.
Yeah, exactly.
Some of
So-
these questions have been great, really kind of like quite thought-provoking, and I think that's also really important for this space, that we're all kind of learning.
Yes, so on that particular note, I'm going to close the Q&A, thank the panel for their insight and being challenged with some hefty questions straight off the bat, and hand back to Sophie.
Thanks, Matt. Yeah, they're really, really insightful. I feel like I've learned an awful lot personally, and I hope everybody else on the call has. I feel like we've had lots of really great insights and lots of fab tips about, you know, being respectful to people's time, ways to starting small, how it's not one size fits all, and making friends with your librarian as well. I'm gonna go away and do that, I think. But yeah, just wanted to say really thank you so much to everybody for attending today. So it's really great to have such a lively chat going on. It obviously makes things so much better to do a panel discussion and Q&A where people are engaged. I also want to say thank you to Megan and Tash, who have been behind the scenes today on the tech side of things. So thank you for that. And sort of thank you to everybody else who was involved in kind of organising the session. So today is part of a kind of wider campaign from Digital Health London around Patient Involvement Month of July. So if you're not already, please do follow Digital Health London on Twitter or social media and LinkedIn, and they're going to be sharing lots more blogs and other podcasts and various resources around ways you can involve people. So yeah, that should be really interesting. Please keep an eye out for that. And it's now 1 o'clock, so I'll let everybody go. But thank you again so much for your time. And yeah, thanks again.